I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. All right, so welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi, and here with me is Rafia Lodhi.
Hey, Dr. Lodhi from North Carolina. How are you?
And this episode is everything you want to know about polycystic ovarian syndrome. So before I get into it, I just want to make very clear that I'm not giving any type of medical advice. So if you're having any medical issues, please seek the help of your medical provider. And if you're having any issues with your religion, please seek the help of your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today, Raf, we're going to talk about polycystic ovarian syndrome. So have you ever heard about this condition before?
I actually have. It's just in passing, I've heard friends talk about it. It never really got into too much detail. So, Dr. Lodhi, can you tell me what it's about?
Sure. So, okay, what exactly is this condition? So this is a condition where the ovaries actually produce a higher than normal amount of androgens, what we consider the male sex hormones.
Mm-hmm.
And what happens then is that these women tend to have a lot of cysts that form in their ovaries.
Mm-hmm.
And if we were to take a look at these ovaries, say on ultrasound, what we would notice is that there appears to be like a little ring, like what we call in medicine a string of pearls.
Mm-hmm.
So if you looked at the ovary, you would see like a pearl necklace. And you see all these little cysts.
Mm-hmm.
And that's considered polycystic ovarian syndrome. Well, actually, the cysts, the polycystic ovaries, that's what we call them. The syndrome is actually what we'll get into a little bit.
Okay.
But with these, not all women that have PCOS have these cysts and vice versa. So not all women that have cysts will have polycystic ovaries. Ovarian syndrome, rather.
Mm-hmm.
And that's because just because you see one doesn't mean you'll have the other. And what happens when we have a lot of cysts, though, is that there's normal ovulation doesn't happen. That's typically when a woman will come to see a physician. So a lot of times these ladies will not have a regular period, or they'll have longer periods. So, or they may go months without a period, and then they'll ovulate. And so that becomes a problem when these women are trying to become pregnant.
Mm-hmm.
And or they are wanting to make sure they're sexually active and they want to make sure that they don't get pregnant. So they'll come in and, of course, they'll always do a pregnancy test. And that's one of the most important things, that any woman that is still having her periods, if she misses a period, to make sure that she always does a pregnancy test, because you want to make sure that you're not pregnant, right? Mm-hmm. But in these women, they will often go on birth control pills. One, if they're trying to regulate their cycles and they just want to make sure that they're getting a period every month. Two, that they want to make sure that they don't get pregnant, so they go on some type of birth control. And or the third reason that women that have irregular cycles will go in and see their provider is if they're trying to get pregnant.
Okay. How does having polycystic ovary syndrome prevent them from getting pregnant?
So that's actually a really good question, Raf. And what happens is these women are not ovulating every month. So as you know, from when we had that talk about the menstrual cycle, that there is every month, there is a cyst that develops, that becomes what we call a dominant cyst, actually a dominant follicle, right, in the ovary. Mm-hmm. So we are born with lots and lots of eggs in our ovaries. And so each month, so we have cysts that develop, and then what happens is that, or rather follicles that develop in our ovaries, and then one follicle becomes what we call the dominant follicle. And then that dominant follicle is the one that releases the egg from the ovary, okay? And what happens with these women is that these follicles, these multiple follicles will develop, right? But there's not one that is releasing an egg.
Mm-hmm.
Okay. So then when an egg is not released, then that during that cycle, that woman does not have a period.
Okay.
Okay. If she's not ovulating,
Mm-hmm.
then she's not going to have a period. Now, she may have some breakthrough bleeding because what happens is that tissue builds up in that uterus so much that you get a little bit of that shedding that happens,
Mm-hmm.
but you won't actually ovulate, right? So if that one dominant follicle doesn't happen, if it doesn't mature and they're not releasing that egg, then they're not ovulating. And so that's a reason why they don't
Can't
get their
get pregnant.
period.
Then they can't get pregnant. Right.
Correct. Correct. Also, they're not going to get pregnant,
Okay.
right? So, also, what we've noted with this syndrome is that they have an insensitivity to glucose, or glucose intolerance, what we call.
Mm-hmm.
And so, a lot of medications that were used in the past and that are still used for women that have polycystic ovarian syndrome is we use metformin. Now, as you recall, metformin is a medication that's used for
Yeah.
diabetes. And so what that does is it helps to balance out that glucose intolerance, which actually leads to the woman ovulating.
Mm-hmm.
And when that woman ovulates, then she's able to get pregnant. So a lot of times, women that have these irregular menses or are not ovulating, we will put them on metformin. And that there have been multiple studies that have shown that that medication actually helps women to ovulate. It regulates their glucose,
Mm-hmm.
and women have noted that they've been able to get pregnant on that.
Is there an age where women get polycystic ovary syndrome, or are they born with it? How do you know um,
Right,
that this is occurring? Family history? How should one
right,
be aware of these things?
right. So, a lot of times what happens is that women will have, so when teenagers first start to get their period, it takes about a year or so for their body and the brain to regulate and also, start to that whole axis that we have. It's what we call the hypothalamus pituitary ovarian axis. And it's the interplay of hormones and signals from the brain that act on the pituitary, which then causes release of a hormone, which then acts on the ovaries. Okay, and that's how the whole menstrual cycle occurs. But when when a girl first starts to get her periods, it'll take the body about a year or year and a half before it starts to get regulated,
Mm-hmm.
before the periods start to
Irregular.
occur, which they happen like every single month, right?
Mm-hmm.
And so what's going to be very important for women that have polycystic ovarian syndrome or think that they may have it is to map out their periods. And so once they start mapping out their periods, then they'll see whether or not they're regular.
Mm-hmm.
And if they aren't regular, then that may be a sign that they have this polycystic ovarian syndrome.
Okay.
Okay. And also, like I had mentioned before, when women are trying to get pregnant or, they're trying to not get pregnant, but they want to make sure, then that's when they seek out a provider. And then a lot of times that's when it'll get diagnosed
Okay. So, I mean,
by
you
the
can
doctor.
have it from the beginning, I guess, not
Yeah.
necessarily develop it over time, but just naturally have it from the beginning.
Yeah, yeah. And, like I said before, one way to diagnose it is not only just with mapping out your cycles, but also an ultrasound that will see those multiple follicles or cysts
Mm-hmm.
in the ovaries, that pearl like strand in the ovary, which oftentimes will let us know that this woman has polycystic ovaries and, is at risk or may have the irregular menses and may be at risk for that polycystic ovarian syndrome. Women that have PCOS can also experience excess body hair. So they may notice that they're a little bit more hairy. And again, That has to do with the excess amount of androgens that are released, or the male hormone, the testosterone that is released when we have these multiple follicles. And they may also have weight gain around the abdomen. They may notice a lot more acne. Some women can even have this male pattern baldness that they see, or like thinning of the
Wow.
hair. So that's important. Um, Also, like I had suggested before, or had mentioned before, is that women will experience infertility,
Hmm.
and they'll often, that may be the first time that they go and seek out the care of their healthcare provider, is when they notice that they're trying to get pregnant and they're not able to, and they have these irregular menses. Also, women may notice like dark or thick patches of skin around their neck or their armpits, or under their breasts.
Hmm.
And that can also be a sign of diabetes. So these women are at an increased risk of being diabetic.
Okay.
And the reason is because, remember, I mentioned that they have glucose intolerance, and we use a diabetic medication to help them ovulate. So this may also be a sign that they're at risk for developing diabetes later on in life.
Okay.
So it's important for women to get this assessed, but also then take ownership of their bodies, and then try to get to a healthy weight, and prevent themselves from getting, say, type 2 diabetes.
So can this happen in women that are normal, healthy weight as well as women that are obese? Okay.
Yes, yes. So women that are normal weight can also have polycystic ovaries. Absolutely. It seems to be a little bit more common than for women that are a little bit overweight,
Hmm.
but those are usually the women that we tend to see that have polycystic ovarian, or at least in my experience with the patients that I had seen in the past. Those women tend to be a little bit heavier.
Hmm.
But again, yes, I have seen women that have been normal weight that have polycystic ovaries. Absolutely.
Hmm.
So, so this is, a question comes up like, can it be cured? And this is considered a chronic condition, but with, you can manage the symptoms. And some of the symptoms are, like we talked about before, if women tend to be hairy, or have more hair on their bodies, what they'll do is sometimes they'll go for laser hair removal, or they go for electrolysis. But remember, not every woman that's hairy has polycystic ovarian syndrome, right? That can be just from genetics.
Yeah.
They can be hairy because, other women in their family are hairy.
Can't relate. Yeah.
Which can happen. Um, but also, like I talked about before, women tend to come in for symptoms. And so if they're experiencing infertility, these women may be at risk for having to undergo, IVF, in vitro fertilization, or IUI, and or need help with ovulation. And that's typically what that ends up being. So that's why we talked about the metformin, but also they may need to go on Clomid, which is a medication that helps with ovulation along with the metformin.
Hmm.
And studies have also shown that those two medications together can help with women in terms of ovulation.
Okay. So
Um,
I read that can the cyst burst as well? That cyst that forms in PCOS?
Yes, you can definitely have cysts that rupture, and it doesn't necessarily have to be only with polycystic ovarian syndrome or polycystic ovarian disease. It can happen in a woman that is ovulating normally, and she can have a cyst that ruptures.
Hmm.
And oftentimes, if that happens, then you can get a little bit of blood in the abdomen, and that can cause severe pain.
Okay.
So, one of the most important things that a woman can do is, if she's experiencing extreme abdominal pain, is to go and be evaluated. First and foremost, make sure that you're not pregnant, right? Because if you're having severe abdominal pain and you take a pregnancy test and you're pregnant, then that can be a sign of an ectopic pregnancy.
Okay.
So that would be important to rule out, you know? And if you take that pregnancy test and if it's negative, and if you're having this severe abdominal pain, then it could be a cyst that
Hmm.
ruptures. And if that cyst that ruptures, if there's a little bit of blood or something like that, then definitely that can cause irritation in the abdomen and cause abdominal pain.
So I just want to be clear, is this genetic? If, say, someone else, you have family history of it, you can get it too, or it's just one of those cases where you're the only one in the family that has
It can be either or.
it? Okay.
Yeah, definitely. If somebody in your family has it,
Hmm.
you're at risk for getting it, or some women just develop it, right? So if one of the things that we note is that it's with, it can be with women that are slightly overweight,
Hmm.
right?
Hmm.
That can cause, or that can be one of the signs that may have some irregular periods, and we note that she has polycystic ovarian syndrome. Then if she loses weight, her periods can actually go back to normal,
Oh,
where she
wow.
can have regular periods.
Nice.
So there are some, things that women can do that can modify their risk
Hmm.
of developing this polycystic ovarian syndrome. And definitely being at a healthy weight is one of those things.
Okay.
And diet and exercise, right? And if a woman that has polycystic ovarian syndrome, if she's at risk for developing diabetes, definitely ascribing to a healthier diet, perhaps even a Mediterranean diet, or say one that, decreased carbs,
Hmm.
will help with symptoms that she may have with this polycystic ovarian syndrome and decrease her likelihood of developing diabetes later on in life, right? Just a couple of statistics that I just want to go over. PCOS is one of the most common conditions in the US, and it affects about 5 to 10% of the female population. PCOS tends to affect overweight women, although it can affect women of any shape or size. And that's kind of what we talked about before.
Hmm.
About 20% of women that have PCOS are classified as lean or non obese. So that's just putting a statistic to that number that you were talking about,
Yeah.
whether or not it's only women that are overweight,
Hmm.
or can it be a woman that is,
Underweight, maybe too.
yeah. Um, yeah, I mean, we don't, I mean, it can be, yeah. Yeah, for somebody that is in underweight, but we typically don't see it with women that are underweight as much. It's typically what I've seen in my practice is women that are slightly overweight,
Okay.
or obese. And again, the other symptoms that women find really troublesome is that excessive hair. It can be associated with this male pattern baldness. Again, that has to do with the increased androgens, right? The male hormones circulating in the body. Um, and the acne and or the increased hair growth that they have.
So what
So
happens if it goes untreated?
if it goes
Yeah.
untreated, I mean, not much. Again, you can definitely, you're at risk, a higher risk of developing diabetes. That's one of the
Mm.
things,
Mhm.
right?
Mhm.
But I mean, some women that have PCOS, they don't necessarily get treated unless they're having symptoms that are really bothersome,
Mhm.
right? So nothing really is going to happen. I mean, women, again, tend to be seen when they're trying to get pregnant,
Yeah.
when they have the irregular periods, and that's bothersome.
Mhm.
So those are a lot of times why women get seen and are treated. And some of the things that we put women are on is birth control, just to help regulate their cycles
Mhm.
if they're having irregular menses.
Does it get worse with age, PCOS?
Not necessarily.
Okay.
No, no, yeah. So it's not something that we would see that would typically get worse with age. No, it's really the symptoms that bring women in.
Okay. It's just to manage the symptoms, pretty much.
Yeah, exactly, exactly. Whether they're experiencing infertility or if they're experiencing irregular menses, those are typically the symptoms. And again, like we mentioned, the excess hair growth, all of those things. So, okay, so I am done here, and it's been real and really intimate. And remember, This is not a substitute for you going and seeing your medical provider. If you're experiencing any of these issues, please go and be evaluated. That's the most important thing. And if you have irregular menses, always, always make sure that you're not pregnant. Or if you haven't had a menses in a really long time, make sure that you are not pregnant. Because if you are pregnant, then you need to be seen. And if you're not pregnant and having irregular menses, then again, you probably want to be seen. So please see your healthcare provider for any concerns you might have. And until next time, this is the Muslim Sex Podcast. Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. And until next time, this is the Muslim Sex Podcast.